Hello and welcome to the channel of Interventional Radiology, the channel of non-surgical alternatives. You can find me and follow me on social media. Also, please, if you're new, please help this channel by subscribing, hitting that like button, hitting the notification bell so you can stay ahead of all my new uploads and videos. If you're new to the channel, you can check out the links on the description, and the links I'm going to put on top that dealt with the uterine artery embolization or uterine fibroid embolization as an alternative to hysterectomy for women who have uterine fibroids. We have spoken extensively about what is uterine fibroid embolization, what are fibroids. So essentially it's a non-surgical alternatives that blocks the blood flow to the fibroids through a pinhole in the wrist under local anesthesia and allow the woman to get rid once and for all her problems dealing with those fibroids, and at the same time avoid scar, surgery, opening the uterus, and all the problems and risk that come with it. Also, it's great alternatives for women who wish to preserve the uterus, whether they for their own personal reason, health reason, or even there are some women who would like to preserve the uterus because they simply want to have babies. So this could be a valid alternative that has been proven by multiple studies, have been validated by different scientific societies, and it's even present within the guidelines. So nothing new under the horizon. We just want to create a better awareness of this procedure and make it easily accessible to the public. So what I'm doing now is presenting a real life scenario, a real case of a woman who came to us presented with a fibroid uterus. So we're looking at the MRI and from the side, this is called the sagittal view. This person had multiple innumerable fibroids that we simply could not count, spanning the whole uterus, causing the enlargement of the uterus that is seen here. We can see the outlines of this uterus that is expanding way beyond the confine of the pelvis all the way up to the abdomen. On the back, this uterus reaches literally her spine all the way to the fourth lumbar vertebra. Multiple innumerable fibroids are spanning the whole thickness of the myometrium. It's these dark round structure that you see on the MRI, causing this patient to bleed profusely, to have anemia that needs transfusion. This patient refused to have a hysterectomy. In addition to the bleeding, these fibroids cause what we call bulk symptoms. So they compress against the spine, they compress, they extend all the way to the anterior abdominal wall. Here we see they compress the rectum in black here, so it may cause constipation. Anteriorly, they may compress the bladder that we see here in white, that's the urine, causing the woman to have urinary symptom. This is the pubic bone. This is a fibroid here that we see in gray, one of the multiple fibroid tumors or benign masses. They're not cancer, they are benign, but they cause tremendous suffering. This is an axial view, so this is just like a slice, and we are looking from the top and scrolling through this uterus. You can see innumerable, uncountable fibroids. Here another view looking at the woman from the front, and you can see again a very large uterus, almost as if the woman was pregnant, compressing the bladder all the way in the bottom, and again multiple. This is the bladder. This is the bladder is compressed, causing urinary symptoms and fullness in the pelvis, as well as heavy bleeding. So how do we treat these? We treat them with uterine fibroid embolization. So basically we do all our procedure under local anesthetic from the wrist. There's no incision on the belly, there's no opening of the abdomen. we enter under local anesthesia the wrist, the artery that is in the wrist, the small artery that everyone can palpate. If you can palpate your pulse, that's the, the radial artery. We put a little bit of local anesthetic, and we use a tiny needle. It's basically like a mosquito bite. Actually, one of my patients called it the mosquito bite procedure. Once we are in the blood vessel like a mosquito, we introduce tiny little instruments that will guide us to navigate within the blood vessels. Once we are in the blood vessel, the patient does not feel anything. It's simply the same thing as the blood circulation. We normally don't feel our blood circulating inside of us. So similarly, this is not a painful procedure. Everything is guided under the help with the x-rays. So it literally takes us 30 seconds to be in the vasculature of the uterus. This is the shoulder of the woman. As we see, we're introducing the elements, and we are following them with the x-ray machine on the camera, and we look at everything. All the intervention is carried out looking at the screen. So we are radiologists, we are interventional radiologists, we use radiology equipment to do intervention. So this is, you're looking at a live case here. Literally, this is how fast and how easy for us it takes a few seconds to be within the vascularity of the uterus. So once we reach there, what we do, we obtain a map of the vessels. Classically, we use contrast media called iodinated contrast media that may cause contrast allergy to some women, or may affect the kidney in women who have poor kidney function and diabetic and predisposed. So to palliate that, I used here in this example, I used CO2. CO2 is basically the gas that we breathe, and we exchange it for oxygen during our normal breathing mechanism. So it's a physiologic gas. You produce 200 milliliter every minute to breathe by your lungs. So we can use this property of the gas of the CO2 to see the blood vessels, so which cause no harm, zero harm to the woman. And we see we obtain beautiful images in a map. Once we obtain the map, we're going to freeze it. We can see both uterine arteries from both sides, and we will use this beautiful map to navigate our instruments all the way down to the uterus. Here we have obtained a nice and beautiful image. We use that using the technique of overlay, which is like a map of the blood vessel. In this case, this is the uterine artery on the left side, the artery that carries blood. And here I'm introducing tiny micro catheters, which is like super thin catheters that you can barely see here. They are very, very thin, much thinner than the artery itself. You can see by yourself. It's like a hair thin type of instruments that are navigated within the uterine artery. This is the uterine artery that feeds all the fibroids, because fibroids will order the body to give them more blood because they are hypervascular tumors. They love blood. So what we do, we use this property against them. We basically stop the blood flow to the fibroid by using those tiny particles called microspheres that are injected within the circulation of the fibroids. Once these particles, these microscopic particles, reach the fibroid, they're going to stop the blood flow from reaching them. And since the fibroid is very sensitive to the deprivation from oxygen, nutrients, and blood, it immediately dies. Whereas the uterus survives this. The uterine artery will reopen within a month, or even less, within a few weeks, and everything goes back to normal. We have to repeat the procedure on both sides. So after we finished the left side, we went to check out the right side, did the same thing. A CO2 run shows a beautiful uterine artery that we catheterized with no incident, and we finished the procedure on the other side. Okay, now let's take a look at the results. Immediately after UFE, the patient's symptoms have disappeared, her bleeding was normalized, and she was very happy. At the third month of the post-procedure, we repeat an MRI. When we do the MRI, you can see there is a notable decrease in the size of this humongous uterus. Now we see that it's not like literally pressing against the spine. It has decreased in height. There's more space on the back for the rectum that can breathe, so constipation will be relieved. This is the rectum here in black. Anteriorly, the bladder has much more space and is expanding and is not being pressed by the huge uterus. All these black spots that you see are the dark, dead uterus, because no more blood comes to us, to them. So since this is not surgery, since we do not open and remove tissue, it is the body natural mechanism and natural cleaning processes that will take place, and gently those cells of the body will start eliminating those dead tissue. That may take time, so that's why there's no spectacular decrease, immediate decrease in the height or volume of the uterus. So, but most importantly, these are just becoming like scar tissue. They will shrink and decrease in size. We are looking here at a frontal view on fast. So again, all those black masses are the dead uterus. So how do we confirm? We inject contrast. We inject a dye during the MRI process, and we make sure that there's no uptake of contrast in the dead fibroids. Fibroids are benign tumor of the uterus, but they do love blood. They're hypervascular, so there's an intense uptake of contrast that appears on the MRI before embolization. They appear white like we see here, and I'm going to put side by side those two MRIs so you can compare. This is after. So we're looking, I'm delineating the blood vessels of the pelvis. So the blood vessels, since they have blood and we have injected contrast, they appear white, like this artery here and the artery on the other side. Similarly, the myometrium will appear white. So here I'm showing you the normal myometrium, because it shows that it's a normal tissue of the uterus. Is white. It contains blood. The dead fibroid mass in the middle is dark. Does not contain any blood, so it does not uptake any contrast media that is injected after MRI. So this is a beautiful demonstration of the power of UFE that takes care of all the fibroids in one session that lasts 40 minutes under local anesthetic, without cutting open the uterus, without having to reconstruct the uterus, because once surgeons have to do a myomectomy, they literally dismantle and butcher the uterus and they have to put it back together. It's called the reconstruction. And once that is done, this is called this is not a normal uterus. Basically, if you have to undergo a pregnancy after that, they will have to do a C-section. This is the side-by-side comparison. On the left-hand side of the monitor, you see the pre-embolization. On the right hand is the post-embolization MRI performed 3 months after UFE. And we can see clearly the difference. Fibroids, this is a sequence where we inject the contrast and to see if the fibroids are still alive or not, to assess the efficacy of the treatment. You can see here that the fibroid is quite large, occupying all the pelvis, extending above the pelvis all the way to the L4 vertebral body, the L4 vertebra. Here a little fibroid, small fibroid in the back that is alive and kicking. It contains a lot of blood. You can see the belly of this big uterus that is pressing on the bladder. It has a big head. Again, multiple fibroids, all alive. This is extending all the way under the belly. Some women may give the impression that they are pregnant when they have this big multi-fibroid uterus. Again, it's really a headache for the surgeon to treat those. So posteriorly, it's pressing on the bladder and on the rectum. Doing some measurements here. This is the measurement from top down in centimeter, including the cervix. And then we measure the anterior posterior diameter here. As I said before, depending on the size, depending on the number of fibroids, like in this case, the shrinkage of the uterus is not spectacular at 3 months. It will take time because, we didn't remove anything. The tissue is dead, but it's still inside. So it's like it becomes gradually like a scar tissue. Some of the fibroids may fall off depending on the location. Some women eliminate them naturally with their period and may not even notice. And some of the fibroids will be eliminated by the natural mechanism of the immune system of the body that will take care of them, making them like a fibrous scar that will gradually disappear. So major advantage here is that the belly is not opened, there's no scar, and when we say there's no scar, there's no adhesion. So anytime there's a surgery done on the abdomen, there's development of adhesion. That's one thing. The second thing, there are no risk, like a surgical risk of hysterectomy, injury in the ureter, injury in the bladder, injury in the rectum, injury in the bowel. These things all can happen. I have seen them. There are no risk of developing post-surgical cellulitis or infection. There's no risk of developing DVT, deep venous thrombosis. Most importantly, recovery is faster, quality of life is much better, and women regain their function literally a few days after this procedure, and they're back to work, back to their normal life. So this is the advantage of the uterine fibroid embolization procedure performed not by a gynecologist, by a specialist called an interventional radiologist. If you wish to know more about this procedure, you need to find out about interventional radiology and about the hidden treasure and hidden procedures that nobody wants to tell you about. Please don't hesitate to subscribe to the channel, join our private Facebook group, link in the description. If you have any question or comment, or if you want me to talk more about anything, don't hesitate to leave me a comment. Thank you for your attention, and I hope this was informative.